Journey begins with a single step, so the saying goes, but a long journey is probably not something your feet would like to think about. Not if it's going to be walked in high heels or with an ingrown toenail or with corns or calluses. Most unpleasant thoughts. But our feet are forced to endure these conditions day after day. Well, here is something pleasant for your feet. They're going to love today's first guest. He's a podiatrist, Dr. Sheldon Nadal, and he's going to tell you how to always put your best foot forward, no matter which foot it is. If you've got a question for him, let your fingers do some walking. The number here is 872-CFTO. When we return, Dr. Sheldon Nadal has got a treat for your feet. Dr. Sheldon Nadal will tell you that you would not want to walk a mile in my shoes, not if it's these. He is a podiatrist, and if you have a question for him, he has all sorts of information, helpful and useful information. Numbered here, as always, is 872-CFTO. And before we get to the fact that these are foot killers, and that I didn't wear high heels today because I knew you were coming in. Let's talk generally about the foot. There are, what, 26 bones in the foot?
Yeah, there are 26 bones in the foot, and it's a very complicated part of the body, and we've got to take really good care of it.
Well, they take a beating. I mean, they carry the weight of our entirety, day after day after day.
That's right. You'll walk a lot of miles on your feet.
And we abuse them.
That's true, especially in high heels, as you mentioned.
We're back to those high heels. Okay, we'll talk about the high heels first. This is too high a heel.
Well, I recommend about up to 2-inch heel. That looks like it's about 2.5 or 3-inch heel.
But they give you such a nice line.
Well, that's true. So you know what? You should wear them when you're going out somewhere fancy. But for day-to-day activities, you're better off in a slightly shorter heel. The higher the heel, the more it puts your weight forward onto the ball of the foot. And that can cause pain. We'll show on our foot skeleton here. It can cause pain at the ball of the foot, and that can cause calluses.
Yeah.
And it can cause the toes to get cramped, and it can cause hammered toes, and it can cause corns. And if you have a bunion, which takes place at the big toe joint, it can irritate the bunion, and it can make it worse.
So if you must wear these, do what started in New York, which was hoofing to work with a pair of sneakers on. Put these on only for show at the office or at the party, and then get them off.
That's right. It's really interesting to see people walking in New York. The young ladies are walking in running shoes, and they have their pair of shoes to put on when they get to work. Yeah,
and running shoe manufacturers have picked up on that, and they've become a part of your fashionable apparel. Running shoes have. The other thing I want to ask you about shoes, and this applies to both men's and ladies' shoes, is this damaging to the foot, the point?
The shoe is pointed, but the toe doesn't quite get to that point, so your big toe doesn't really get to the end of the shoe. But it will pull the big toe over toward the little toes, and if you have a pre-existing problem like a bunion, it can aggravate it. If there's not enough room in the toes for your, if there's not enough room in the shoe for your toes, and you've got a hammered toe, it can irritate that hammered or crooked toe, and it can form a painful corn. So it is pretty important to wear shoes that have enough room for your toes.
What's the most common foot ailment that you see in your office?
We get a lot of people with bunions and ingrown nails and corns and calluses.
We're going to talk about what to do about ingrown nails, but I think first we should talk to Jeannie. Good morning, Jeannie.
Good morning. I have a problem back. And I wear pumps at all time. Is it better to wear a closed back or a sling back?
The shoe, it's better to wear a closed back shoe because the closed heel, it helps to grip the heel and it helps to control and support the foot, whereas an open sling doesn't really give you any support.
Thank you. Yvette, you are on the air.
Hi, I wear a steel-toed shoe, and I find that when I'm at work, I'm perfectly fine. But then about an hour after when I get home, I can hardly walk on the instep and the ball of my foot. What could that be from?
You may be walking on concrete and you don't have enough cushioning, so you might need a softer outer sole on the shoe. The other thing is some people, their feet aren't balanced properly and they need more support than they're getting. You may need a custom insole made for your shoe. That'll take a lot of the pressure off the ball of your foot and rebalance the foot and get rid of a lot of the pain that you're having.
And Yvette, Dr. Nadal did bring a couple of insoles with you as well, didn't you? Do you want to describe these?
Okay, this device is a sport device. It can be worn in your running shoes, and it can be worn in many men's shoes and a lot of boots. But for women that are in more fashionable shoes, it won't quite fit, so we make something a little bit narrower.
But this is something she could put in her work boot.
Depending on the type of work boot she might be able to get into, and it'd probably give her a lot of support.
That's terrific, and it's transferable.
Yeah, it's transferable. It doesn't stick in the shoe. It's transferable into all your similar shoes.
Now, this is something you would go to a podiatrist, and it would be made specifically for you.
That's right. It's made to measure.
All right. And this?
This is a more fashionable device for a more fashionable shoe, and it's made a lot narrower, so it'll fit into ladies' shoes. There's no point making a device that won't fit into your shoe because it won't help you.
There are some orthotics, as these are called, that can be sort of bought just over the counter, off the rack in drugstores. Do they serve a purpose? Sure.
If you just need some basic generic arch support, they'll be very helpful. If you have more specific problems, you may need a more made-to-measure device. They are less expensive because they're off the rack, and they will help to a certain degree. If they don't do the trick, you may need something made specifically for your foot.
Elia, hi.
Hi. How are you?
I'm just fine. How about you?
Okay. I have a question. I have corns on my toes, and they've been there for about a year. And I was wondering how I can get rid of them.
Okay, corns are due to crooked toes rubbing in the shoe. If you can get a shoe that doesn't press on your toe, that'll get rid of the problem. If your toes are really crooked, it won't do the trick. You may need to see your podiatrist. He can scrape the dead skin and put a pad on your toe to give you some temporary relief. If that doesn't do the trick, the corn can be treated surgically under local anesthesia with a technique that we call minimal incision surgery, where it gets rid of it permanently and you're able to walk right away.
I have known some people who have had that surgery done, and I was surprised how quickly they bounced back.
Well, we just do foot surgery. The only type of surgery we do is on feet, and we've had to get really good at it. And we've developed techniques to keep people ambulatory and to get them back to their activities as quick as possible.
Earlier, the subject of ingrown toenails came up, so let's address that one now.
Okay, ingrown toenails are very painful to have, as any of your viewers who have experienced it will tell you.
And you do not get the tweezers out.
You got to be careful. What happens is the nail doesn't grow flat, it curves in and it digs into the soft tissue. And if it's really bad, it can become red and swollen and infected.
What can I do for it?
If it's mild, you can soak your foot in some warm salt water, usually about a quart of warm water and a tablespoon of salt, and that'll soothe it. If it persists, you can try to remove a little bit of the corner of the nail, but you have to be careful. If it's swollen and red, you may need to have some antibiotic, and you may need to have it corrected properly by your podiatrist.
While we're on the subject of toenails, I cut them straight across.
Yeah,
even though they look so much nicer when you paint them and they're kind of curved on the edges. That gives you ingrown toenails, possibly.
You can irritate your skin if you dig into the corners. You shouldn't do it unless you have a problem. If the soaking and trimming the nail doesn't do the trick, then you should see your podiatrist because he can take care of it properly and permanently.
Linda.
Hi.
Hi.
I'm 7.5 months pregnant, and I'm trying to stay active by cycling and walking, but I find the arches of my feet are always sore. Is there anything I can do?
Yeah, it sounds like you need some arch support. When you get pregnant, you obviously weigh more, and it's putting more stress on the arch of your foot. You can try the commercially made devices that you can buy at, in the drugstore. If that doesn't do the trick, you may need better support, and you can get a hold of your local podiatrist, and it'll make quite a difference.
We have an address and a phone number where you can get in touch with Dr. Sheldon Nadal, and also this is the address and phone number that will put you in touch with the Academy of Ambulatory Foot Surgery.
That's right. We specialize in keeping people ambulatory, so we keep them out of the hospital, we get them back to work, and we want to keep them walking.
Pain in the foot is something that most of us have learned to live with, but it's deciding when I'm having too much pain to deal with it myself, that it's beyond normal pain and soaking isn't going to help. When do I make the decision that it's time to get myself to a podiatrist?
Well, if the home remedies aren't doing it, then it's time. You don't want to procrastinate. You don't want to let things get worse. The sooner a problem is treated, the easier it is to take care of it.
The old adage about being flat-footed, which used to keep gentlemen out of the army years ago, still holds true to a certain extent, but having a high instep can be just as difficult.
That's right. You want to have a foot that's balanced properly. Somebody with flat feet can get heel pain or arch pain. Somebody with a high arch foot, the weight isn't spread evenly across the foot. It's all at the heel and at the ball of the foot, so they can get pain at the ball of the foot or in the heel. And somebody in the Army who has to do a 10-mile march with a 20-pound pack on their back can end up with a stress fracture, or what they call a march fracture, where the bone actually breaks.
Ooh, ouch.
That's right, it hurts.
Well, if you take care of your feet, you won't be saying ouch. Dr. Nadal is a podiatrist, certainly a person to get in touch with you. Again, at the end of the show, we will give you the address and phone number if you missed it so you can get in touch with the doctor and the Academy of Ambulatory Foot Surgery.
Thanks very much, Noreen.
Thank you.